I will be your moderator for tonight's event, which is co-sponsored by the Center for Innovation in Social Work and Health at Boston University and Vote ER, a nonprofit, nonpartisan organization focused on healthy communities powered by an inclusive democracy. Our goal at the center is to provoke thought and stimulate action consistent with our mission to improve health outcomes, population health, health equity, social justice, and expand the impact of social work in health. We are dedicated to expanding the impact of social work in healthcare and public health in order to improve the health and well-being of vulnerable populations globally. We define health in broad terms, consistent with the World Health Organization, to include physical, mental, and social well being, and to involve work at the individual, family, community, institutional, and societal levels. Vote ER integrates voter registration into the healthcare delivery system. This organization is founded on a core belief that empowered voices and full participation in the democratic process led to positive health outcomes. Co-sponsors with our Health Equity Speaker Series allow us to highlight cross-cutting work and develop new partnerships across professional disciplines, systems, and sectors. So before we begin, I'd like to review a few housekeeping items. Each presenter will speak for 15 minutes. Then after all the panelists have presented, we will have some time for audience questions. Please type your questions into the chat window in Zoom, and we will take as many as time allows. If you are a social worker needing continuing education credits for this event, you will receive a link in your email to a quiz that you must complete to receive the continuing education credits. We will also place this link in the chat for you to use. The event is being recorded and will be available on our website at www.CISWH.org. To get today's program started, I'd like to introduce our first speaker, Catherine Kate Audette, social worker and change maker. Ms. Audette is the Director of Government Affairs at Dana-Farber Cancer Institute and a lecturer at the BU School of Social Work. She is a government relations professional with a demonstrated history of working in the healthcare industry. Ms. Audette focuses on policy practice, nonprofit organizations, board governance, grassroots organizing and lobbying, and program evaluation. She has a deep commitment to the community, equity, and educating the next generation of social workers. Now, please welcome Kate Audette.
Good evening, everyone. Good evening, and thank you, Ellie, for that warm introduction. It is so great to be here with all of you tonight. This is a topic that I am really passionate about and excited to be in community to discuss. Also want to shout out Vote ER and specifically Christina Witten O'Brien for helping to connect me to tonight's event. So I'm going to go ahead and share my slides. Hopefully everybody can see my screen. And it's just processing there for a minute. So I want to talk a little bit about this idea of politics as prevention and really speak to those of us who work in the healthcare industry and setting opportunities that we can use in our private and our public life to really drive social change and engage in civic participation. So before I begin, I do want to say that the views and opinions expressed during my presentation do not necessarily reflect any of the different organizations that I partner with or that I am employed by. So I want to start off tonight by having, just an understanding that in this country, our democracy is in a very fragile state at the moment. And in particular, what we're really seeing is that we don't have a government by the majority, but we have a government by the majority who participate. My assumption is that if you're taking time out of your busy schedule to attend an event like this, that you're hopefully somebody who is actively participating in voting. If that assumption is incorrect, then I hope that this is an opportunity for you to start to think and plan ahead about opportunities to engage in our democracy by voting. But for those of you that might be like me, who already actively participate and vote every chance you get, tonight is an opportunity to deepen our commitment to our democracy and think about ways that we can make tangible contributions towards that. So one of the things I often like to think about, and that Ellie mentioned in the introduction, is this idea of representative democracy. And this is a picture from 2003 when then President Bush was clearly surrounded by a constituency that did not reflect the policies that were being signed into law, which at that time in this picture were a significant expansive ban on abortion care. Fast forward over a decade later, and we continue to see the same thing happening in government. A democracy that is not representative, that is again making decisions about access to abortion care. So I show these two reminders, albeit a little bit dated, just to show that this concept of politics as prevention is something that we can think about now. Many of us are not in the midst of an election cycle. We may be looking towards the next one, but now is really the time to think about what are the tangible things we can be doing to ensure a more representative democracy, how we can be engaging, how we can be politically active to ensure a more representative democracy going forward. So the three goals that I have for this session, one, that you tap into and claim or have a reclamation of your power and what you can be doing as an individual and as part of a collective to help strengthen our democracy and drive us forward towards a more representative democracy. Then I'm hopeful that folks will think outside of themselves and think of our patients, our clients, our community, and what are the opportunities that exist for us to help empower them to become civically engaged and engaged in our democracy. And then finally, anybody that knows me knows I'm a very results-driven, strategy-focused person. So I hope that you really leave here tonight after hearing from myself and Alistair and Justin with tangible, specific things that you can do professionally and/or personally to more fully engage in our democracy. So one of the questions I get so often, or a refrain that I hear so often is, I work in healthcare, I can't be politically active at work. And so if there's one thing that you take away from here tonight, it's that that is not necessarily true. So I want to start by kind of disaggregating this idea of political advocacy versus legislative advocacy, just to give us some common language throughout my remarks tonight. So when I think about political advocacy, I tend to think about the people. When I think about legislative advocacy, that's more about policy or the process. So when we think about political advocacy, engaging in voter registration and education, voting ourselves, being involved in campaigns, that is distinctly different in terms of my remarks tonight from policy advocacy or legislative advocacy. But I am going to touch briefly on both in terms of opportunities, again, for folks to be fully civically engaged. So advocacy at work. I'm situated in Boston. I work in Massachusetts, where many of the healthcare providers here tend to be nonprofits. So what that means is that whether you're at a healthcare nonprofit or a human services nonprofit, there are opportunities to be politically active at work. The key is really remaining nonpartisan. What does it mean to be nonpartisan? It means that you're not endorsing or opposing candidates or showing any type of political party affiliation. It means that you're not using any nonprofit funds to contribute directly to political campaigns. But what it means you can do is nonpartisan voter registration and education, and a host of other things, such as organizing around the US Census. If you're somebody who works in a for-profit setting, for-profit healthcare or other entity, there are far fewer restrictions on what you can do. So that's something to keep in mind. Regardless, if you want to engage in political advocacy at work, checking in first with a general counsel, your supervisor, or an office of government affairs, if there is one, is a great place to start. So again, I started to mention some of the really tangible things that we can do in our workplace, whether it is a nonprofit or a for-profit workplace. One of the great things to do is look at the employee handbook and policies and see, are staff given holiday time in order to vote? What are the policies, particularly in healthcare settings like a hospital that might be 24/7? What are the opportunities that folks have to vote? How is that being worked into busy provider schedules? Participation in the census is something that I am deeply passionate about, and that because it only comes around every 10 years, sometimes folks forget what an important role the census plays in civic engagement. And we're actually seeing that happen now in the redistricting process in states. So, engaging in census advocacy and ensuring that patients and your colleagues are completing the census, again, only happens every 10 years, but the ramifications of getting a complete count or not getting a complete count are huge. So, there are ways to engage there. Organizing discussion groups and encouraging staff to think critically about the mission of your organization when voting are nonpartisan things that can easily be integrated into staff meetings or community meetings happening in the workplace, specifically at times around elections. Where I work at Dana-Farber, we are really proud to be kicking off next month a new partnership with VoteER, where we are going to be rolling out a campaign called Civic Health Champions. And so we are going to be integrating into our clinical workflow opportunities for voter registration and education on a daily basis, both with our patients and employees. And again, a few other things to keep in mind that you can do in the workplace: hosting mission focused, nonpartisan candidate forums. This is something that I've done while working in a network of community health centers. A great way to help educate your patients, your employees, and the community about folks that are running, particularly for offices, across the spectrum from city to state to federal. And another thing that I've done working in a healthcare setting is handing out to patients and employees information about what their voting rights are, how they can get an absentee ballot. If somebody's going to be inpatient for a long period of time, helping them to develop a plan in advance for how they will vote, absentee or by mail. Now, I mentioned policy advocacy, and I just wanted to touch on that briefly as well, because there are opportunities to integrate that into your work life and healthcare as well. One of the things I tell folks often that I work with is invite your elected officials to come see our work firsthand. And of course, if they accept that invitation, you want to let somebody like your supervisor or the Office of Government Affairs know. But having legislators come see your work in healthcare firsthand is a great way to help inform decisions that are being made in the policy realm relative to your patient or client population. In addition, you can leverage your expertise by writing verbal testimony or giving oral testimony before a committee or a regulatory body to help decision makers, elected and appointed, to understand the impact that their decisions can have on your patient population, your profession, and your community. So, what about in your spare time? Well, it's important to note that in your spare time, you can most certainly do work that is considered partisan. I do it all the time. One of the things I make sure that I do not do when I am volunteering and doing political work on my spare time is I don't wear any, hospital affiliated or associated apparel. So I'll leave my hospital fleece at home. I make sure not to wear anything that identifies my employer, just to make sure there's that clear separation. But in our spare time, we can volunteer on political campaigns. We can volunteer to be poll workers, join a legislative or political action committee, consider donating or volunteering on political campaigns. And then, of course, you yourself should consider running for office. So just one example of something that I've been engaged with, and I know that there is a heavy audience of social workers in attendance tonight, so I'd be remiss if I didn't mention our national association, the National Association of Social Workers, and the fact that they have a political action committee, which is called PACE, Political Action for Candidate Election. And that is a great way to get involved in your spare time to help build political power for social workers, get boots on the ground to see and learn firsthand who's thinking about running for office or running for reelection, helping to create a scorecard and a candidate questionnaire that reflects the NASW policy agenda. And it's just a great opportunity to engage civically with like-minded professionals from social work. Another example that I'll give, and this is very Massachusetts specific, but for those of you that might be in other states, it is an incredible model to build off of, and a model that we are really seeing the fruits of the labor continue even on today. So I am a proud board member of the ACLU of Massachusetts, and several years ago, the ACLU of Massachusetts created a first in the nation, first of its kind campaign called What a Difference a DA Makes. And this campaign sought to help voters to understand the power and the impact that DAs have. The campaign featured online videos, there were candidate forums, a very significant social media presence. And the campaign even went behind the wall. The campaign went inside local Massachusetts correctional facilities where candidate forums, nonpartisan forums, were held and led by folks behind the wall. And as a result, you can see in this picture, Rachel Rollins subsequently went on to be elected the first woman of color to serve as Suffolk County DA, and just today was confirmed to the United States DA to be the next United States DA from Massachusetts. Again, the first woman of color to do so. So you can see the impact that these types of nonpartisan educational and awareness campaigns can have in the community, not just educating folks, but also, not so much creating a seat at the table for folks, but as you can see here, literally picking up the table, moving the table, and bringing the table directly to impacted constituencies to raise awareness. So with regards to kind of legislative electoral advocacy, this is something that I think we all can be mindful of year round. And so some things that we can think about that are progressive actions that we can take and that we can support in the policy space are restoration of voting rights for returning citizens, same day voter registration. Where I live in Massachusetts, we're considered a very progressive state, but we don't have same day voter registration. Taking a look from a policy perspective on term limits and things like campaign finance, those can be really heavy policy lifts because term limits and campaign finance reform typically have to be undertaken by current elected officials. And so you're asking them sometimes to move on reforms that may not be in their best interest. But it's those types of things that really do help advance our democracy, and specifically efforts to a more representative democracy. Again, voting by mail, early voting, keeping an eye towards redistricting. I know many states have just completed that process as we have here in Massachusetts, but paying attention to how those lines are drawn is critically important towards moving towards a more representative democracy. And then one thing that we do have here in Massachusetts that I think is a fabulous model for other states is pre-registration, pre-voter registration for 16 and 17-year-olds. So at the point where our young adults are learning about civic engagement in high school in Massachusetts, they can be pre-registered to vote. And so long as they remain in Massachusetts on their 18th birthday, they're automatically registered to vote. So these are some of the progressive things that we can help to advocate for and advance in the policy space that move us towards a more representative democracy. And then finally, I'd be remiss if we didn't talk just very briefly about the things that we need to be on the lookout for and try to prevent from happening. But unfortunately, we are seeing movements of all around the country. And those are efforts to suppress voters. These are efforts to keep us in a space where we don't have that representative democracy. And some of those policies that are most often generated specifically in states include, but are certainly not limited to, the idea of exact match with regards to voter registration restrictions, purging of the voter rolls, which we have seen in several states in the South. Something that I am passionate about and unfortunately exists in my community that I am trying to help get rid of is the law enforcement presence at the polls. I don't believe that there's any reason that I need to be checked in or checked out of my polling location by an armed police officer. So those are things that exist only in certain communities in Massachusetts, mine being one. And, it's something that I think we need to do away with to make a more inclusive voting experience for folks. And again, closing of polling locations and gerrymandering, which is tied to redistricting, are all things that we as advocates need to be on the lookout for and oppose, particularly now as we see many of these efforts being successful, quite frankly, in states across the nation. So in closing, again, I want to thank Ellie for this opportunity and for curating this incredible space. I can't wait to get to question and answers and hear from the audience. And before I turn it back over to Ellie and the other panelists, I just want to close with the late Rep. John Lewis, who really was just such a leader in voting rights and representative democracy work, where he said, never be afraid to make some noise and get into good trouble, necessary trouble. So thank you again for the opportunity to be with you all tonight, and I'll turn it back over to you, Ellie.
Thank you, Kate. So many wonderful examples of how all healthcare providers can take action. Inclusion and equity can be achieved if health providers are at the table. And we're going to continue. Thank you, Kate, again. Our next speaker is Dr. Alistair Martin, founder, board chair at Vote ER, assistant professor at Harvard Medical School. Dr. Martin leverages his background in politics, healthcare policy, and in the field of behavioral economics to use the ER as a place to build programs that serve the needs of vulnerable populations and patients. He's the founder of Get Wavered, co-founder of Got Vax or Get Out the Vax. And in 2019, Dr. Martin founded Vote ER with a team of healthcare providers and behavioral science experts to help patients vote like their health depends on it. In 2021, Dr. Martin was appointed by the White House Commission on Fellows to serve as a full-time paid fellow for White House staff, cabinet secretaries, and other senior government officials. Please welcome Dr. Martin.
Thank you very, very much for that awesome introduction, Ellie, and it's great to see you again. Kate, thank you for that incredible intro to the work and just being the perfect example of organizational leadership and the fact that none of this happens without folks who are on the ground and who are willing to go to bat for good ideas. There's a bunch of slides I'm going to present. I'm going to tell you a bunch of stories, but before we get to all of that, I just want to say thank you to all of you. And I mean that from the bottom of my heart. The work that you all do as social workers is health equity in action, in motion. It's not the words. It's not the rhetoric. It's not the fancy metaphors and allegories. It's what you do on a daily basis that actually makes our patients better, our hospitals better, and our country better. And I thank you so much from the bottom of my heart. Social workers have been, to me, the real heroes when it comes to doing the critical work of making our healthcare system work in a fairer way and a more just way for the patients who need it the most. So thank you very, very much. And you're going to see that when social workers talk, I listen and I learn because you all really do have your finger on the pulse for what's right most times. So I'm going to share my screen here and tell you a grander story about the work that we've been doing at ODR. So first of all, can everybody see my screen here?
Yes, we can.
Cool. Fantastic. Oh, there's one disclosure I was supposed to say. I am here on my personal, in a personal role as a volunteer board chair of Vote ER. My professional role is I work here at the White House for the Vice President as a senior advisor on voting rights. But the work that we're going to talk about here relates to the work that I do in my personal capacity. So let me rewind the clock man, this is long. I'm like aging myself now. Dang. So I was a third year resident. So that might have been 4 years ago. I'm getting old. And I was working at Boston Children's Hospital. And it might have been like, I don't know, y'all, 1 or 2 a.m. There's a switching hour in the emergency department when you begin to see the real social emergencies. And I had this young woman come in to the emergency department with her 2 children, and both of whom were younger than the age of 3. And she told me, Doc, look, I just moved here to Massachusetts about 6 months ago. And I did so to try and escape a situation where the father of my kids was physically abusing me and sometimes the kids. And we had nowhere else to go. So we came here to Boston. And for the last couple of days, the person who I moved in with, who's an aunt of mine here in Boston, she and I had some friction and she kicked me out. And last night, the 3 of us slept in our van, but it was so cold and I could see how they were shivering through the night. There was no way I was going to do that to them again tonight. So I had nowhere else to go. So I decided to come here to this ER. Can you help me? And I remember you know, thinking to myself, where do I even start? But what came out was, yes, of course I can help you, and did what most ER docs do in this case. Social work to the rescue. Called the social worker and I said, hey, look, you've got a young woman here who needs temporary housing. What can we do for her? And she's got her 2 kids here as well. And the social worker said at the time, okay, well, look, all you got to do is, tell her about a couple of programs that we have here. We have some state programs that can get her into transitional housing. And all she has to have is some proof of identification that she lives in the state. So I went back to the patient and said, we can definitely help you. There's just one quick question. Do you have like a phone bill or a light bill or a piece of mail that says that you live here? Because we have to prove that you live in Massachusetts to take advantage of these Massachusetts programs. She said, no, doc, as I told you, I just came from another state. So I went back, called the social worker and I said, hey, so she doesn't have mail or proof of residence. What can we do? And he said, well, it's not much, but there is one thing that we could do. And I said, what is that? He said, well, we could help her register to vote because her voter registration would count as proof of residence in the state of Massachusetts. So, a lot going through my head again, but the most important thing was, is this legal? Can we actually do this? And the social worker taught me that no, actually, because of the National Voter Registration Act, it's actually totally legal to register patients to vote in a nonpartisan way. Now, look, I spent hundreds of thousands of dollars at the Harvard Kennedy School before this experience, and I didn't learn that, and I want my money back. But basically, this was my first experience understanding that nonpartisan voter registration in a hospital is totally legal. But when I went back to the patient to say, hey, look, we can help you register to vote. Do you want to register to vote? And that voter registration is going to count as your proof of residence. This was her answer to me. I didn't know I could. No one has ever asked me if I wanted to be registered to vote before. And she is just like the 50 plus million other unregistered voters in the United States. That amounts to the entire population of Spain. And when you ask folks who have not been registered to vote, why haven't you? The number one reason is I've just never been asked, right? And so we've got this huge opportunity in community health centers, in clinics, and in hospitals to help people, to extend our hand to many of them for the first time, to take part in our democracy and help them have a seat at the table. And I don't have to tell you all this. As social workers, you know better than I do, but there's this incredible demographic overlap between folks who are unregistered but eligible voters and folks who are marginalized patient groups. They tend to both be younger, lower income, and are more likely to be people of color. And there's another opportunity here. The opportunity is not just the place, but the people, right? Healthcare providers are some of the most trusted messengers. And so we have an opportunity to reach out to these really hard to reach potential voters and offer them, again, a seat at the table. All right, so that's all rhetoric, but how do we actually do that? How do we concretely make it possible for folks to register? So we do that in 3 ways. The first is we create these healthy democracy kits. These are created with 2 specific behavioral insights in mind. The first is salience. So the idea that something that's new, that's atypical, that's shiny, captures attention. And so when your doctor is walking up to you and they have a lanyard that says register to vote on, you've never seen that before. So often folks will ask, what is that about? And that will trigger the second piece, which is the ID badge that you see there that providers wear on the back of their hospital IDs. That allows people to register to vote using a QR code or a text message code on their own phone. And that insight, behavioral insight, is ease. When you make things easy for people to do, it's more likely they're going to do them. It's not rocket science. The second lever that we pull is through posters and handouts that we actually deploy physically to hospitals and community health centers. We have over 700 hospitals and clinics that have these posters, have these handouts, and folks can use them while they're sitting there in the waiting room or in the clinic and register to vote. And I didn't mention this previously, we have over 25,000 healthcare providers who have those healthy democracy kits. Now, lastly, and this is probably the most shrewd of the interventions, is we leverage community health centers to send text messages to the patients that they already care for to register to vote. So like you see here, this is a community health center sending a text message to one of the patients in a patient pool. We've had nearly 24 community health clinic partners and have sent hundreds of thousands of text messages. I want to now drill down and give you a story to take home of how this is actually used. This is Dr. Stager. He's a pediatrician who uses VoteER to start conversations with her patients about the importance of voting. And she does the same thing that I did when I was in the ER. She asks in her social history, do you smoke? Do you drink? Are you registered to vote? And if the patient is not registered to vote, she helps with her Healthy Democracy Kit. As I mentioned, we have 20,000 plus providers out there with these kids. When we broke down who actually were these folks, you'll see where we need your help, because I think what is probably already standing out to you is the fact that there's a lot of room for improvement on the social work side, and that's where we need your help. But 60% of the folks who use our kits were physicians, meaning folks who had graduated medical school, were in residency or internship or fellowship, or who were beyond that. 23% were students, 10% were nurses and PAs, and 7% were social workers. I used to tell the team all the time at VoteER that I believed, and I still do, that social workers are multiple times more effective and impactful potentially when it comes to doing voter registration with VoteER. And I think we will see that day come sooner rather than later. When we ask our healthcare providers, why do you choose to help your patients vote? The number one answer that was given back in 2020 was, well, we want to help address social and racial inequities. And now you met one side of the equation, Dr. Stager, who's a pediatrician. I want to tell you a story about Lauren, who's one of her patients. So Lauren is a patient of Dr. Stager. She's 19 years old, and she had never registered to vote before. And she saw Dr. Stager's badge. She was able to register to vote. And not only that, she then went home and helped her parents and her sisters who had not registered, help them register as well. And we know from the data that we've collected, we helped over 46,000 folks like Lauren with the voter registration or mail-in ballot process. This is just some of the racial and age data that we have. The bottom line here is that about half of the folks that we've helped identify as people of color, and about 40% are younger than the age of 29. What's the takeaway? The takeaway is that the groups that we are helping in places like community health centers and hospitals are just younger and more likely to be diverse than where traditional voter registration happens. And so in summary, we helped just over 46,000 folks. Nearly 70% of the folks who completed their process of voter reg or mail-in ballots actually voted, which is an important statistic. Over 28,000 of these kits are out there and used by healthcare providers, and then hundreds of hospitals and hundreds of associations. And so what we're seeing now nationally is a coming together of healthcare providers, of social workers, of students around this concept, this idea that when it comes to thinking about health equity, we've got to begin thinking about civic health of our patients and thinking about voter registration and making it easier for patients to actually turn out as an intervention in itself. And one of the big lessons, stories that we learned is the power of community organizing. This is an example that demonstrates to you one of our experiments that we ran in 2020. And the experiment was, what happens if we teach students how to run a team, manage a team, and become community organizers with the goal of registering patients? What we saw was nearly 100 times impact when you compare an individual with a Healthy Democracy Kit to an individual team captain and the subsequent team that they built. So the bottom line is we learned that when healthcare providers come together and act in an organized fashion, they are multiple times more effective than when they do it alone. And so that's the work that we've been doing in 2021, is really sort of flipping the script. We don't want to be mobilizing as in a traditional campaign. Every time there's an election, we ramp up, and then when the election's over, we ramp down. No, instead, what we want to do is, when the election is over, continue the work. And that's what we're here doing today. We're continuing the work, continuing to build this message, to build power together with you, and to recruit hopefully many, many, many more social workers into the healthcare civic health movement that we've created. There are a couple other ways that we've been doing that. One is we have something called a Civic Health Fellowship, where we've taken a number of healthcare providers along a 10-month journey, where we've taught them really in great detail community organizing principles. And it's not just that. We then also unleash them into their communities and give them feedback and give them guidance and give them coaching and have them develop and grow as community organizers in their own rights. And then lastly, we help to popularize the concept of Civic Health Month, celebrated every August. This is organizing at a different scale, not individual organizing, but organizing of organizations. And proud to have CISW and Boston University School of Social Work as incredible partners in that work. So where we're going is, we want to get to a point where the majority of all healthcare sites have voter registration, are doing voter registration, doing it in a nonpartisan way. And we can get there with your help. I'm going to end with, the work is not done. It's just beginning. 2022 is around the corner. And so follow us on Instagram, Twitter. We tried TikTok. If you find us on TikTok, there might be a video of me dancing. I hope that we've deleted it, but I think it still might be there. So you may want to check TikTok. If not, check the Instagram and Twitter, and I'm going to hand it back over to Ellie. Thanks, y'all.
Thank you, Dr. Martin, for your stories. The idea and the importance of engagement in the patient-provider relationship can really have such an impact about access, both by registration, but also by means in which families can access their voting right. So thank you for sharing those stories. And there's great questions coming through the chat as speakers and presenters are sharing their ideas. And I just want to encourage everyone to write questions you may have in the chat, and we will review those questions and take as many as time allows. We'll also post the quiz for anybody who is seeking CEUs for social workers at the end of the presentation. And it'll also be available on our website at www.CISWH.org. Thank you, Dr. Martin. And with my pleasure to present our final speaker, clinical professor Justin Hodge from the University of Michigan School of Social Work. Justin is the co-lead for the Policy and Political Social Work Pathway organization and the director of the online certificate in political social work. Professor Hodge is committed to increasing the presence of social workers in policy and political spaces. He was elected to the Washtenaw Community or County Board of Commissioners in November 2020, and nationally serves as the Director of Education for the Congressional Research Institute for Social Work and Policy, which works to expand the participation of social workers in federal legislative and policy processes. Professor Hodge is dedicated to mental health and public health on both a policy and individual level. He's also worked as a direct care social worker in practice and leverages these experiences as both a clinical and macro social work practitioner. He feels strongly that all social workers should be involved in our democracy. Please welcome Professor Hodge.
Thank you, Ellie. Thank you for the kind introduction, and thank you to the other panelists. Really fantastic presentations. It's just tough to follow that. I'm really excited to be here. I remember learning about VoteER a couple of years ago, and I thought, wow, this is such a fantastic organization, and I wanted to figure out how I could get involved. And it's just been really awesome for me to be able to have some of the contacts with the team that I've had over the last several months, and be able to increase my involvement, and then try to bring the University of Michigan School of Social Work in as well. I'm going to go ahead and share my screen, and we'll get this thing going. So I am going to talk a bit about some of the work that we're doing in Washtenaw County. We've heard a lot about voter registration work and things at the national scale. I'm going to pivot and talk a bit about what we're doing at that local level. And of course, I'm going to encourage all of you to consider running for office and to get more involved in your local government. So I'm going to give you a little bit more of an introduction about myself. The introduction was great. I just want to add a couple of things because I think my background in social work changed, or my career has changed so much over time. And I really try to use that to encourage people that are doing clinical social work to think about how they can make a shift to at least do a little bit of policy work too. Then I'm going to turn to talking about some of the policy successes we've had in Washtenaw County, focused on health equity and racial justice. And I'll talk about what some of the challenges that we're seeing as we try to respond to the pandemic and do more health equity focused work. And then we'll talk about a few action steps I want people to think about doing. So just to add a couple of other pieces about me and some of the details about what some of this stuff means. So at the University of Michigan School of Social Work, what we call our pathways are basically majors. So I'm the co-lead, so I've developed several of our classes for our policy and political social work pathway. And I went from doing clinical social work. I used to do child and family therapy and case management for kids and adults with developmental disabilities, and did a lot of crisis intervention work with teens at risk for self-harm or had suicide attempts. And it was my work when I was working for a community mental health system during the time when our governor and the state legislature cut the budgets to the CMH system dramatically. I was one of the social workers on the ground that had to tell a lot of my patients I couldn't see them anymore, and it happened so quickly. Many of them didn't have a clear transition plan when they left. So that's really what spurred me to want to get more involved in policy and political work. It's looking at the people that are elected and seeing that many of them don't have a social work background. They're not approaching things from a social justice mindset. And you see that in the kind of policies that you have. So from there, I started working to get appointed to different local boards and commissions, and kept finding myself to be the only social worker in those spaces. Even when I was on like a civil rights commission, where it made a ton of sense for social workers to be there, because our responsibility was to advise the city council on social policy and mediate civil rights complaints. But being the only social worker in that space, and then in other spaces where we're giving out grant funding to human service agencies, and there's a bunch of lawyers and business people there instead. So that's when I started to think about what could I do to try to bring more social workers into this kind of work. And I reflected on my time in my MSW program and thought about how there wasn't a ton, there's policy content, but there wasn't anything necessarily focused on politics. And we could do more with policy. So a lot of things happened, and eventually I ended up getting the position that I have now, and had the great fortune of coming into the school during a time when they were doing the first major curriculum revision in about 30 years. So I was able to push a lot of that into the MSW curriculum. And then I also developed for continuing education an online certificate program in political social work for professional social workers. Because my thinking is you got to get the students while they're students, and then you got to get the people that have already graduated, get them when they need their continuing education as well. I was elected last November to serve Washtenaw County as the county commissioner for the 5th district. I don't expect people to know Washtenaw County geography here, but in case you do, I represent most of Ypsilanti Township and all of Augusta Township. And I want to point that out, and this will come up as I talk later. People tend to think about Washtenaw County and think, oh, the University of Michigan is there. There are a lot of other really cool things there. Everyone must be super wealthy. That's not true at all. Washtenaw County is one of the most economically segregated regions in the entire country. And a lot of that concentrated poverty that we see in the county is in my district. So I do a lot of work around health equity and trying to address economic inequality. My thinking is that I want to try to inspire students to run for office, because they can see they have a faculty member that's teaching classes on policy and politics, who's an elected official and has the same degree that they're about to be getting. So far, I think I've been pretty successful. I've had 2 former students run for office and win. So that's one of the metrics that I'm looking at to see how successful the program is. So Turning now to some of the work that we're doing in Washtenaw County related to health equity, we, as the county government and our county, what we took a look at is what can we do to try to get the county operations to operate in a way that is more racially just. And in 2018, the Board of Commissioners created the Racial Equity Office. It took a little while to get it up and running, but we have a racial equity officer. We have staff in that office now. And what they do is they take a look at the county government's policies and procedures and work with department heads to try to change what we're doing internally to make us operate as a place that is more racially just. The county racial equity office also does work in the community. So there's the county organization, the government itself that they do work with. They're also doing work outside with other local governments and working with organizations in the community. In 2021, so recently, one of the things coming into office, one of my top priorities was figure out how can we get more money to the Racial Equity Office. It's still a really small office, and them getting established right as the pandemic is taking off, they didn't grow as quickly as we had planned. So a few years ago, the voters of Michigan passed a ballot initiative that legalized recreational marijuana. And the thinking behind that ballot initiative is that tax money that the state would be getting should be used for racial equity initiatives. So one of the things that I was able to do in 2021 was I pushed a county resolution that directed that tax money that the county receives from the sales of recreational marijuana, so it goes to the Racial Equity Office. So it's a pretty big win. I feel like earlier on in the term, and it's a consistent stream of income for that office. Just I know people like to see pictures too. One thing that I have learned in the little bit of time, but a year I've been in office so far, is that whenever you're doing something, we got to talk a ton about it and make sure that we're getting clear information out. So this is just a screenshot of a headline that we had about this, because I don't think people tend to think that, oh, the government is trying to approach things from a racially just lens. So I reached out to a number of news agencies, and we got people to cover it. That's something that's just been increasingly important, especially as the local governments are moving forward with the American Rescue Plan funds that Congress and the president got out to us. So making sure that we're getting clear information out and working well with the press to do that. So another success that I want to talk about is in 2020, the County Board of Commissioners and our Board of Health passed resolutions declaring racism to be a public health crisis in the county. So this is significant for a number of reasons. The Board of Health took lead on that first, so they passed it, and then the day after that is when the Board of Commissioners did it. So for people that aren't familiar with what boards of health do at county level, that's a group of appointed residents that advise the Board of Commissioners, so the county government, and then the health department on issues related to health. And ours has been particularly focused on health equity. Those kinds of policy-making bodies, even though they're made up of residents, you're still able to make policy, and it does have an impact. So it was really encouraging to see that the residents that were on the board at the time thought it was important enough to take the steps to declare this, to declare that racism is a public health crisis. And then the Board of Commissioners followed that up the day after and passed a similar resolution. So this, making this declaration came along with funds. So as we're thinking about how do we approach the work with the Racial Equity Office and looking at public health challenges that the county is facing, we're using that resolution to say, hey, this is the reason why we need to direct funds in this direction. And it took a lot of work to get here. There was significant community engagement around the development of the resolution. A lot of research went into it, and work with the health department to identify where there are health disparities in our county. So again, just to show you another thing, it was nice to have these two headlines come out back to back between the Board of Health passing that resolution and then following that up the next day with some good coverage of the work that we were doing at the county level too. This is another one that can be a bit more complicated, but I'm really excited about this resolution. So in 2021, so earlier this year, we passed a resolution that requires our Board of Commissioners, the county government, so the county administration to county departments to use this tool that we have called the Opportunity Index in our decision making, so both for policy and for programs. So the Opportunity Index is a tool that maps opportunity across the county, including health outcomes. So we use this to try to figure out where do we need to target our interventions. So the challenge, so for me, I had always been a huge fan of the opportunity index. The county had it for years prior to me becoming a commissioner, but it wasn't really getting used at the time. Like, it was this great data-driven, a tool that could be used to drive data-driven decisions, but it wasn't being used formally. So one of the things I did earlier on in the term was figuring out how can I require that we use this. So I was able to sponsor a resolution that made us implement it into our decision making. And really, this is fantastic for how we're trying to address health and economic challenges. This is what it looks like. So there's this color coded scale. And what's really interesting about the tool is that you can break it down into the different areas of opportunity that we look at. So what I'm showing you here is the aggregate scores for all the areas. So the dark blue areas are the areas of higher opportunity in the county, and the darker red areas are the very low access to opportunity areas. So the part of what I represent of the county is that lower right portion of that map. So there's a lot of red there. So that's the aggregate score, but you could break it down and take a look at things, just health. So you could look at health outcomes specifically. You could look at, and then the other scores are job access, economic well-being, education and training, and community engagement and stability. Voter registration is also included within that community engagement and stability metric too. So I bring this up because these are really awesome tools that I think anyone listening to the call could think about trying to bring to their local government. Passing resolutions that declare racism a public health crisis, or using tools like an opportunity index to be able to drive those decisions that the county government is going to be making. So to talk about a few challenges that we're facing, we continue to face. The politicization of public health has been a really serious problem. We have had protests in some areas of the county about mask mandates and vaccine mandates in different areas, even if the county is not involved in it. There was a Board of Health meeting, and I currently chair our Board of Health that I was running, and we knew that ahead of time there was going to be a group coming to protest the health department on that day, not for any particular reason, just that they had been doing protests at city council meetings across the county and at school board meetings. So we have a Board of Health meeting, and we have all these people outside the health department building that are protesting about mask mandates with some really ridiculous signs that just didn't make any sense. So this is something it's a challenge. It's a challenge for public health professionals in this time, as their work is politicized and not taken seriously in the way that it needs to be taken seriously. Misinformation has been a really huge challenge. I mean, you see this, and we talk about this at the national level, even as a local elected official. I mean, misinformation has been much more of a problem than I anticipated it would be coming into office. And that it's really unfortunate when you have community groups or sometimes respected community activists that are actively spreading misinformation about work that's being done. And then something else that is like more broadly, most elected officials are not healthcare, come from healthcare or have any kind of experience like that. And we would see different policy if we had more elected officials that were social workers or public health professionals or doctors or people in the medical field. So that's just something else to think about. And I also see that as an opportunity, though, where us that have that kind of experience and expertise, that's all the more reason why we need to be engaged with our elected officials so we can share that, share our expertise and help guide policymaking in that way. Similarly, we all need to take it upon ourselves to make sure that we're pumping out factual information. I mean, that's the best way to combat the misinformation and the politicization of public health that we're seeing. So I'm thinking about some next steps. Really engage your policymakers, especially at the local level. I mean, you probably run into your local elected officials when you're out grocery shopping pretty regularly. I mean, you'll run into city council people or county commissioners at Kroger, or maybe you don't have a Kroger in your area, your grocery store. You should do that and provide them with data and recommendations. I mean, my expertise is in social work. It's not in aeronautical engineering. So when we have to make, I always use that as an example, but then I actually had to make some decisions related to aeronautical engineering. I was like, I got to use a different example now because that is something that comes up. But be prepared to be able to share that expertise because people want to hear what you have to say. I would also suggest that you try to have that one-on-one engagement and build those relationships with your local elected officials. And look at serving on local boards and commissions. That was really impactful for me at helping me get more involved in policy work, is figuring out, go to your city or township or county website or your state website, and there's going to be a spot on there that talks about boards and commissions that residents can serve on. Work on campaigns, in your spare time, it's already been mentioned, but work on campaigns. It's much easier to replace an elected official that doesn't align with your values or align with the work that you want to see. It's much easier to replace them than it is to get them to change their values. That's just not going to happen. So you got to replace them. And who better to replace an elected official like that than you? Consider running for office. I strongly believe that social workers are the best equipped people to serve an elected office. I mean, there's not another field that trains people in the way that we get trained, where we get trained in policy, political social work, community organizing, interpersonal practice, management of human services, research and evaluation. Those are all excellent skills that I think, we would want any elected official to have. And those are skills that we have as social workers. So think about you as yourself being a person that runs for office so you can be a champion for public health. And if you really can't do it yourself, find somebody and encourage them to run for office, because we know you have to encourage people to run for office multiple times before they would really seriously consider that. And just to wrap it up, I think all of us would want you to think about a few things that you can do over the next month to be more socially and politically engaged. It could be looking at, maybe you take the step and you take a look at what are the boards and commissions in my area, and then you go about the process of applying. And I think that's good. I want to make sure we have time for Q&A, so I'm going to wrap it up here. Thank you again, everybody, for being here and for having me. Really excited for the next part of the panel.
Thank you, Professor Hodge. That was really wonderful. And we're getting great questions rolling in through the chat. I do want to encourage anyone who has a question for our speakers, our presenters, to please list it in the chat, and we will go over as many questions as time allows. And also for social workers that are seeking CEUs for tonight's event, we will be posting the link for the quiz in the chat. And also you can find that at our website at www.CISWH.org. So one of the things that we talked about in sort of developing today's discussion was around representation matters. We see misinformation and the lack of expertise about what communities need. What data is available that would help us understand the representation of either health providers, social work, or healthcare social workers in elected roles currently?
I'll take that one real quick. That data is hard to come by. Now, Congress does that for people that are, elected to Congress, and tries to keep track of what, professional background people come from. But besides that, it's really hard to do that. And for social workers in particular, it's hard for people to gather that kind of information, because unless you're licensed, and a lot of people that are doing macro social work are not going to be licensed, it's hard for like the NASW, for example, to be able to figure that out unless you advertise that you're a social worker as part of your campaign or in your bio. If you're not licensed, it's really tough for people to know. So that's one of the challenges, unfortunately.
Thank you. So I as a follow-up would be, it seems like there's a need to research this further. And are there any ideas or projects that could be recommended for us to advocate for?
I can just jump in and just piggyback on what Justin said. That was spot on. The only other data point, as I've been sort of thinking through this, is many of you work in hospitals and in clinics and in community health centers, and often the folks who make up the leadership of these institutions are very much data driven. And if they don't understand the scope of the problem, often they're not moved, right? And so at least when I'm thinking about how do I begin to sequence a campaign to make something happen in my hospital, I think about the part of it that is, the heart, telling the stories, making sure that we communicate why it's important to be doing what we're doing. But I make sure also to communicate the data piece to acknowledge the brain portion of the argument that needs to be made. And so having the data at hand around voter registration numbers in your community and the turnout of elections in your community is really important for a couple of reasons. The first is, often if it doesn't get measured, it doesn't change, right? And so in our hospitals, if we're not taking this information back, hey, look, we purport to be a place, a bastion for health equity, and yet the number one or the first step in ensuring that our patients have access to care is actually giving them a voice in our democracy. And right now, it doesn't look like that's happening based on the data that I see, right? So having that data, voter registration numbers and turnout numbers, I think can be persuasive to some administrators in the hospitals and the clinics and community health centers that you work at. I think it's also important because many of you are, let's be honest, you're formal or informal researchers yourself. And there's a body of literature that's coming out right now. It's real hot, it's real new. And it's about identifying correlations between voter participation and health outcomes. Voter participation, health outcomes, what I mean? What I mean is you go down to Dorchester in Massachusetts or Roxbury, another low-income community in Massachusetts. And everyone just implicitly understands, well, gee, man, they don't have specialty clinics here. They don't have a tertiary hospital here. They don't have access to healthcare here. And that the health outcomes are low. But also people implicitly also understand, well, gee, probably they're not voting, right? That's all an implicit understanding. No one's really been able to kind of capture that data yet. So that's the other way that data could be helpful to make the case that there's a link between, look, you care about health outcomes for our patients. Well, the way you do that is by making sure that folks have an easy route to the ballot box. So that's just building on, I think, the excellent point that Justin made.
Thank you. A question from our audience from Zoom. I ran for office in the last cycle and have been trying to get my students to run for years. We absolutely need more social workers in elected spaces. What do you identify as the barriers, individual, systemic, and institutional? And what are strategies to overcome these?
Well, I'm glad you ran for office. I mean, you got to do it. You got to stick at it. I ran for county commissioner in 2018 and didn't win. Decided I don't know that you didn't win, but you said ran, so I wasn't sure. But I didn't win in 2018. Tried again in 2020, then it worked. I think one of the barriers, like we talked about, or like Kate mentioned in her presentation, is that social workers frequently find themselves working in spaces like nonprofits. There's a lot of misconceptions around what can you do and what can't you do. And then people tend to err on the side of caution and just don't engage, or they don't talk about campaigning, or they don't talk about the importance of politics. So I think it's clearing up that misconception around what nonprofits can and can't do. I'm sorry. Yeah, so you'll get them next time. You got to stay in there. So that's part of it. I think another piece of it is that we need to be doing work to help raise the wages of social workers, because social workers don't make as much money as lawyers tend to, and then it's easier for people to max out their campaign donations, for example. But I think the biggest barrier really is that social workers tend not to think about themselves as people that should run for office. And that's something that all of us can change by having the kinds of conversations that we're having here today. And like you did, led by example. That's what we have to keep doing. Because, you can't win it if you ain't in it. And we have to get more social workers in it for us to be able to, take some of those seats. I always dream that, we're going to have a day where we have two really qualified, fantastic social workers running against each other. And it would be an awesome campaign. But we have to really do the work to encourage people to get in there and do that.
We as social workers need to support social workers when they run. And I just want to call out, I noticed that Carla Monterio has joined us. Carla is a dear friend, a sister in social work who recently ran to be a Boston City Councilor. And I was so proud as a social worker to support one of our own. And so I think that's another critical piece, just to add on to what you said, Justin, that, when we see social workers running, we need to come forward. We need to support one another and lift one another up, volunteer on those campaigns, support those campaigns. And a great way to find the social workers that are running, I can only speak to NASW Mass PACE, but they do a great job of finding those social workers that are running, not just at the federal level, but the state level and municipal levels, and communicating that to the membership. So you are able to see in real time who's running to represent you that has a social work background, and to learn about those candidates.
Thank you. I also wanted to just again ask the question about any foreseen some of the institutional barriers that social workers, healthcare providers face in looking at their role in a more elected role or policy making. As we've sort of noted, that there aren't a lot of these providers with their areas of expertise at the table.
And I'm seeing it pop up in the chat. There's the conversation about how do you go about running for office when you're in a really demanding field. I mean, both, the work itself is challenging, but it also takes an emotional toll. That is a challenge, and that does make it harder for social workers, I think, that will try to make the leap to run for office. Um, so finding the support system to help you get through that is really going to be essential. I mean, but part of the barrier is the kind of work that we do, and sometimes the hours that we have to work. The other piece of it is, if you are doing a job that you really love, many elected offices are full-time or considered full-time, many of them are part-time, so you might not want to leave the job, and that can be tough. Like being county commissioner in my county, I could spend, and sometimes I do spend, like a full-time amount of time on it. We don't get paid that way, so most of the county commissioners have another job, and it works out that way nicely for me. But then there are some counties where their county commissioners are expected to be full-time people, which I would love that, but that's not where we're at right now. So that's I think the challenge is the time constraint. That is a difficulty, and then figuring out if you're seeing clients, or like, let's say you're in private practice, that might be a little bit easier for you to be able to work around campaigning, but it is hard. I mean, I think that is an institutional barrier too, is just the challenging nature of a lot of that direct care work that social workers do. Now, if you're doing community organizing work, it's, I think, an easier shift into that work.
Great, thank you. A question for Dr. Martin. Um, One of our Zoom audience members wrote, I work in HUD assisted housing. Is there a way to use what Vote ER does with the tools that are used in the ER?
Yes, fantastic. And just one quick tech note. I am using a government computer, so I cannot look at the chat. The chat is disabled for me, so I can't follow anything on that. So I'll just look to the moderators to give me a heads up if there's anything relevant to me. The short answer is absolutely. We have a number of different resources that could be useful. And one of my VoteER colleagues will put their email or the email of the best point of contact in the chat, and we can follow up with you to get into some detail. And I'll leave it to them to kind of decide what the best approach is. But the bottom line is there's a number of different approaches, including using posters or handouts that can make it really easy with QR codes and text messages. And we've got a real slick system that makes it easy for organizations to get on board. So thank you for the question, and we would love to work with you.
Are there any examples, Dr. Martin, of housing providers or housing programs that have successfully used the strategies and tools from Vote ER?
Yeah, great question. So Boston Healthcare for the Homeless is an organization that we've worked with in the past. And one thing that I'll say about the community that they serve is that a lot of what I've mentioned is phone driven, right? A patient has to actually have a phone to use the QR code or the text code. But back in the day, before there were ever any healthy democracy kits or posters or handouts, the first thing that we made to actually help people register to vote was a stand that had an iPad in it. And the iPad was locked to a voter registration screen, meaning the only screen that you could use on that iPad was the voter registration form. And so that's the kind of thing that we, deploy in places like Boston Healthcare for the Homeless or folks that don't have access to phones. So that's an example in how we use technology in different ways for different communities.
Thank you. This is a question for Kate. Kate, what do you think about the shift of social work to private practice? How can NASW and others get social workers who feel they want to do solely clinical and or individual work to engage more in what they see as the macro field?
Absolutely. So I think Alistair and Vote ER is a great example of a way to engage for even folks in private practice, having those tools set up and utilizing those tools and integrating nonpartisan voter registration and education into the clinical workflow in private practice. In addition, I think folks in private practice, I was just on a number of calls today. We're dealing with a policy issue around out of network or surprise billing. And some of the things that are happening will touch social workers in private practice. And I haven't heard from a single social worker in private practice, like, how are you going to manage this? Were you at the table when these decisions were being made? Have you weighed in about how this will impact your patients, how this will impact your workflow? And so I think that's another great way that social workers in private practice can leverage their expertise to help show policy and decision makers the impact that their policy choices will have on patient populations, communities, and the social work profession and clinical workflow. So I think those are just a few examples. One of the things I say all the time to my students at BU is that, there's a role for social workers to play in all milieus, and we certainly need social workers in private practice. However, the call of our profession, the teachings of our profession are rooted in, and there's a reason that we are trained in simultaneously clinical work and policy advocacy. And that is because the call of our profession is not just to put Band-Aids on the problems of society, but to actively engage in trying to bring about systemic change and fix those issues. So whatever that looks like for you, whether it's engaging in voter registration and education, sharing your expertise with policymakers, there's a number of ways that you can engage in the macro work and the system level change work. But I just encourage you to find whatever those issues are that you're most passionate about, and make it a regular and frequent part of your social work practice.
Thank you. This question is for Alistair or Dr. Martin, sorry. Do you think that the voting question should be standardized and be a part of a clinical intake for mental health and substance use patients?
Yeah, really good question. I think it should, if and only if we can do so while also optimizing for not ostracizing our immigrant populations, folks who are undocumented immigrants. And the reason why is that, I don't know if folks have caught the news out of New York City recently today, but other than New York City, if this measure passes, there is no instance where undocumented immigrants are invited into the voting process, right? And so one vexing challenge that we've had to grapple with at ODR is the patient populations that are often most marginalized also include undocumented immigrants. And for those patients, actually having signage up and posters and things that sort of look a little too in your face about voting, we don't have the data to support this, but my sense is that could come across as, as a place that is not hospitable to undocumented immigrants. And so I think that the question should definitely be part of the process once we understand where someone is in terms of their immigration status. Or you do what we do at ODR, and that is build in contingencies into the question. if you are able to, do you want to check your voter registration? Right? If you are able to, do you want to explore options for voting from home this year? Right? And that if is an important if, because if they're not able to, then, maybe they don't want to have that conversation. So the short answer is yes. The long answer is definitely more complicated. But great question.
Thank you. This was a question for Professor Hodge. How do you deal with the negativity during campaigns?
Yeah, that is it's a good question, and it's a really challenging one to deal with because to some extent, people I think feed on the negativity. And that one thing that happened during the campaign is I would put out really great policy statements about different things. Wouldn't get a ton of traction with those on social media. Sometimes I take a picture of my dog and then try to work something campaign related in there. Those would get better than just me talking about policy. But the social media post, the non-advertised, I had to do the social media advertising, but the non-advertised post that did the best was when I did a post about someone having lit one of my yard signs on fire that a supporter had. And I put that out there not thinking it was going to get all these shares and likes and then all this conversation about it, just to say that this is not the kind of campaigning that we want to see, or the kind of tenor of the conversation. It shouldn't be this way. But then it blew up. So I would say part of it is, again, having a support system set up throughout the campaign and really leaning on your team throughout it. I mean, you got to have a lot of people that, that you trust with you throughout that whole process. And at a certain point, it gets easier. I mean, in the beginning, it's really easy to take everything that happens super personally. But over time, I hate to say it this way, but you kind of get used to the negativity in it. Like we had last night I had a listening session with a couple of the other commissioners, and most of them went fine until towards the end, where we had some people that really don't like us. And then they were able to seize the microphone for a good 15 minutes to tell everybody how much they don't like us. But I mean, you get used to it over time, unfortunately. But so I would say the best answer is understand that it's part of what you're going to be dealing with. Get involved in trying to get more social workers engaged in it, because I think you get more social workers involved in politics, eventually it'll change what politics looks like. But in the meantime, you have to have whatever you do to take care of yourself and make sure you get enough sleep. That's another key thing. You have to make sure you're taking care of yourself physically and mentally throughout that process, so you can tolerate a lot of that negativity that's going to come up.
Thank you. That's very helpful. I know we're often, advocating and sort of sharing with others the importance of self-care. So I can see how that goes hand in hand with some of the challenges campaigns face. I want to go back to a question for Kate, specifically about how and can pre-registration be done in other or all states? And then a follow-up question, how do you coordinate pre-registration of 16 and 17-year-olds?
Absolutely. So, in order for pre registration of 16 and 17-year-olds to happen, legislation does need to be passed in the states to codify that. And I put a link in the chat. The National Conference of State Legislatures, or NCLS, has indicated that there are about 19 states that are doing some version of this. So, you can use that resource at NCLS to see if your state is one. If your state is not one of those states, NCLS, I believe, is one of the national organizations that provides model legislation. So you could look into that model legislation and work to help get something filed in your state to move you closer to codification of pre-registration for 16 and 17-year-olds. Once you have pre-registration codified for 16 and 17-year-olds, like we do in Massachusetts, the way that works is many of the voter registration and education and outreach opportunities that exist make it a point of mentioning this. So at Dana-Farber, when we're doing voter registration and education, we mention that. Are there 16 or 17-year-olds in your life that would want to pre-register? We know that schools play a significant role in that outreach. So that's how you can get there. You need to pass legislation codified in your state. There are places where you can find that model legislation. Lots of organizations are doing that work. I know in Massachusetts, when we passed it, there was a coalition effort that was coordinated by the NAACP. I believe ACLU was at the table. Mass Vote, Roxbury Vote, the faith community came together. So building a coalition to pass the legislation. And then the great thing is that coalition that can help you pass the legislation is also the same community focused groups that can help spread the word about awareness once it's passed and do that outreach to get 16 and 17-year-olds registered.
Thank you. I think we have time for one final question. Um, and I think this works for all the panelists. The audience member on Zoom said, "Today I was on the phone with Medicaid Mass Health in Massachusetts, and they asked me if I would like to register to vote. I was impressed. Were you aware of this? And what has been happening in terms of automated voting registration across the country?"
I can start that given the Massachusetts tie-in, and Kate, would love to also hear your perspective on this, but definitely aware of that. The challenge with automatic voter registration in Massachusetts, as in other places, is that you have to be in the system to be automatically registered to vote. So, for example, in places like Massachusetts, you have to have a driver's license, and that information is what's used to register you to vote. And so that certainly helps, but there's a huge population of folks who don't have driver's license who are gonna miss in that way. I think a part of the question was what more can be done on automatic voter registration. A lot more. A lot more. And I can just speak to one concrete example from the federal government side. There was an executive order that was signed back in March by the president, Executive Order 14019, that required all federal agencies, all 14 major federal agencies, to come up with a plan to register more patients to vote and make it easier for them to vote. So one of the plans that was proposed early was for the Department of Homeland Security, which is the department that does naturalization ceremonies, people who are newly made into citizens in this country. Well, for every naturalization ceremony that happens, you also have voter registration that happens right there. And it's a 1-2 step process, right? And so there are lots of examples like that throughout the federal government where we could piggyback on processes and or just make it like one step, as in the case of getting naturalized also means you are now registered to vote. We're trying to sort of think through how that could work at the Medicaid level across the country using Medicaid data, not the data from like your driver's license. So really important question, and there's a lot to be done on this.
I would just add that there's voting rights laws that look so different across the country, and it's really important right now that we're advocating for the Freedom to Vote Act. The For the People Act would have been fantastic, and it included automatic voter registration in it, but we got this pared down version that is one of our potentially final chances to help save our democracy. So I would say whatever you can do right now to engage in advocacy around the Freedom to Vote Act, do that.
Yeah, not too much I would add, except, I think it's great that states like Massachusetts have automatic voter registration, but there are limitations, as Alistair mentioned. And so I think programs like VoteER and integration of voter registration and education into social work workflows is important, because we know people move. We know people have name changes, and all of those things can impact your voter registration. And so that constant education, that constant awareness and reminder to folks is really helpful. And one of the things that I would be remiss if I didn't mention, working for a comprehensive cancer center, is that we found in the very early stages of integration of some of these questions and this dialogue into the workflow, it helps to demonstrate to our patients that we are looking at them as a whole person. We are not looking at them just as a cancer patient. We're looking at them as a person first, and treating the whole person, and really interested in all of the facets that make up who they are. So I think there's really positive clinical indications to integrating this into our workflows, regardless of the milieu, and it helps us stay on top of those subtle changes and things that might be happening that could impact someone's current voter registration if they are already registered. So just taking nothing for granted when supporting our patients.
Well, thank you very much to our three panelists and presenters. We appreciate you sharing your valuable time and tremendous insights with us tonight. Thank you for inspiring us with your innovative work. Before closing for the evening, I'd like to take a moment to thank Vote our co-sponsor in organizing tonight's event, specifically Christina Witten O'Brien, Director of Partnership at Vote Courtney White, Ryan Fensinger, and I would also like to say a special thank you to the Center for Innovation in Social Work and Health, specifically our fellow Victoria Brown and the entire staff. A big thank you to the School of Social Work Marketing and Communications team for their leadership in promoting tonight's event. On behalf of Vote we would like to invite you to begin registering clients or patients to vote and order a health democracy kit by going to voter.org, which will be in the chat. Also, if your organization wants to support civic engagement and or be a Civic Health Month partner, please go to civichealthmonth.org, which will also be in the chat. We hope that this information from the panel can help us all take additional action in our work to advance health equity. Thank you and good night.